Joining us tonight. Wendy's a specialist horse vet. She graduated from Bristol in 1999. She then went on to complete a residency at Liverpool University and held a European diploma in equine internal medicine. So she really knows what she's talking about. Wendy is going to talk about worming in horses, and especially this time of the year, the winter time. And if you've got any questions during the talk, if you enter them on the chat box, the speech bubble on the top line, Wendy will stop from time to time and we'll answer them. So Wendy, over to you, please.
Thank you. So I've just noticed that it said it was having some problems sharing, so we'll just try that again. Just try and share that. Can you see my screen okay?
Yes.
Yep. Perfect. Okay, I'll just go into slideshow and I'll turn the video off while I'm presenting at the moment, just to make sure that the internet connection stays okay, and that you can see my screen, which is the important thing, rather than seeing me sat here in the cold. And then we will stop and pause for questions through the presentation. Okay. So thank you for joining us tonight. I hope you're sat with a glass of wine, which always makes winter worming go down a little bit easier. And actually, it's a really good night, I think, not to have to come out into the cold to kind of do this. So what we'll be going through over the sort of next 45 minutes, really, we're going to keep it sort of quite short and to the point, and then have plenty of time for questions as well. So the idea is to go over the specific threats that you might encounter in winter time, and importantly, what you need to do about that. So to have some explanation of the parasites that might be a problem at this time of year, and then what you need to do to be able to tackle those. And then we'll start thinking ahead for next year as well, and be thinking about, okay, what do we need to start doing? How does this all fit into the plan for next year? Because it's all about making sure that it's right for your individual horse. So some of the winter specific threats that we see, the main ones are going to be encysted small redworm, and you'll hear me talking about that a lot in this presentation. There's also tapeworm that we need to consider at this time of year, and bots in all horses. And then pinworm can be a problem in some specific animals as well, so not all of them. But we'll talk about these in more detail in the coming slides. Just try and advance the presentation. So we're just to introduce you into encysted small redworm, I'll play this video for you.
Wendy, the video isn't playing.
Oh. Okay. Is it just stopped on the first screen?
It's stopped on the worming time it right, the first slide, yes.
Okay, that's odd because it's on my screen. It's on my screen, it's playing. Let me just try again and just see whether that's going to play. Okay, that should be going now.
No, it's not.
Oh, okay. Let me just what I'll try and do is come out of presenter mode. So can you see the first slide on it now?
Yes.
Yeah, let's try on not on presenter mode. Is that any better?
Yeah, it looks like we can see it now.
Yeah.
Fab. Okay, so I just pop back into the presenter mode. So just from that video, the small red worm, encysted small red worm, is the stages, the larval stages of the small red worm, which are present in the horse's gut. And the majority of those occur over the winter period. And this is because during this time of year, as we all know, it starts to get a lot colder, and the conditions for the parasites to be able to reproduce and to cause infection on the pasture has really decreased over this time. So the larvae depend on the temperature and the water, the humidity and the warmth in the environment to be able to infect the horse. And at this time of year, as the temperature starts to drop below about 6 degrees centigrade, then those become much less able to cause infection in our horses. I think it's really important to realise that it doesn't actually kill all the eggs and larvae on the pasture. So we tend to think about, okay, we've had a frost, it's going to kill the eggs and the larvae that sat on the pasture. But actually what they do is they sort of sit there in a state that isn't able to infect the horse. So if the horse takes them in, they might graze and they might take in those larvae, but they're not actually able to cause infection. They're just not active. They pass through the horse without causing any problems. But what they will do is sit there on the pasture until the beginning of next year, or the ones that have already been ingested will start to bury into the gut wall and to set themselves up for a type of hibernation, which is where these encysted stages come into play. And it's really a survival mechanism that they know that they can't really do anything very useful to transmit to horses on the pasture over the winter period. They might not survive. So it makes much sense for them as a survival mechanism to stay inside the horse where the body temperature is going to be much more constant. And they've got a constant supply of nutrients from the horse's blood supply and from their gut as well. So these pictures here, this one on the left-hand side, this is a section through the gut wall. So it's a slice which is taken of the tissue that's sat inside the gut wall. This pink tissue on the inside should all be the same sort of colour, and it's the area where the horse absorbs the nutrients from the large intestine. These big areas that have got this white kind of filling and then this kind of sort of blobs, if you like, inside those are the encysted larvae which are curled up and sliced through. And what's really clear on this section is that this has taken up a large amount of the intestine's normal absorptive surface, which means it's very difficult for that horse to get the nutrients and the water that it requires as well. This other picture on the right hand side, this is from the inside of the gut itself, on the surface of the gut, and this shows the larvae that have started to emerge, and each one of these little red pinpricks represents an area where the larvae have come out into the gut wall. And I think for me these pictures are a really graphic image of the damage that the larvae cause, both when they're sat inside the gut wall and also when they start to come out as well. And that's
Wendy,
yep.
do you think you can make those pictures any bigger? They're not actually on full screen.
Oh, okay.
If there's any way we can see the full detail, please.
I'm on presenter mode, Rod, at the moment. So let me see if I can zoom into those. Is that better?
No.
Oh, okay. So on my screen, that has actually zoomed right in to that.
Okay, Tom, any suggestions?
We could just see the preview in PowerPoint, so maybe try resharing PowerPoint as a window.
Okay, let's try that again. Let's try resharing. Is that better?
Not yet, actually, still the same.
Okay.
The option would be to share your screen. That might help.
That is what I'm doing. I'm sharing the screen at the moment. Look.
Ah, that's better.
Yeah. Okay.
Yeah, that's it. Excellent.
Ah, fab. Okay. Okay. I see. Okay. Sorry about that. So yeah, hopefully you can see those detail a bit better now with the larvae that are sat in the mucosal wall and causing the damage there to the intestine, and then where they come back out into the gut themselves. So with encysted small redworm, larval cyatostominosis is the technical term for when that actually causes damage and causes clinical signs to horses. And that has a mortality rate. Unfortunately, once this starts to show signs, there's already a large amount of the gut that has been damaged. So there is a 50% death rate once they start to show clinical signs, which is obviously a very high death rate and obviously far more than we would want to entertain. So for that reason, it's really important to recognise horses as to why they might suffer from encysted small redworm and what are the risk factors that might occur for that to happen. So any horse can suffer from these stages. The stages which encysted in the gut wall are the stages, they are part of the normal life cycle. Those larvae go into the gut wall as part of their normal kind of survival mechanism at this time of year. What differs between horses is that some horses will have a very large burden and that some horses will have some that are less intense. So there's less larvae that are sat there and also less that come out of the gut wall once we get to the springtime. So they sit there over winter and then in the spring period, they may come back out and cause problems if they all emerge back into the gut lumen at the same time. And we don't fully understand why this happens with some horses and why it doesn't with others. What we do know is that there's an increased risk of age and that horses less than 6 years old are more likely to have this problem. And this is very much likely due to their immune response. So they may have less of an immune response, or conversely, it might actually be that they're having a heightened immune response because it's the first time that they've seen them. Either way, the important message for us as owners is that it's those younger horses that are more at risk, but every horse has the potential to have these. And then the time of year is really important as well. So this time of year, the late winter through to early spring is the time when the parasites are going to be trying to avoid the weather. And that those are going to have the highest burdens that are sat within the horse. Recent treatment with some types of wormer can as well, quite worryingly, cause those symptoms to start. And I'll go into that in a little bit more detail in the next couple of slides. So just to reiterate, this is something we have to think about in all horses, but it is something that we can preempt to some degree. I think importantly as well, the times that I see that it's a big issue is very much when pasture management isn't optimal. So if grazing has not been cleared over the summer period, if it hasn't been kept on a good management, then there's much more potential for horses to get an infection and to build up those parasite stages which overwinter with them. Importantly, for diagnosis of this, they won't show up on a worm egg count. We do advocate use of worm egg counts, and we'll go on to that later on in the presentation throughout the grazing period. But these stages, remember, they're sat inside the gut wall. They're the larval stages, and therefore they don't produce eggs which are going to be passed out in the droppings. So a worm egg count at this time of year can be very misleading because it won't show those pasture stage, those stages which are sat inside the gut wall, those encysted small redworm stages. We do have a blood test now, so not us personally, but there is a blood test that is available that can be done by a vet to show whether small redworm is present. There are limitations with how that should be interpreted, and all horses which have had a recent egg count over 200 eggs per gram, they also need to be treated as if there's small encysted stages present as well. So it's not the be all and end all, but it can be something that is used, and it's recommended that every horse at this time of year is either tested to see whether they have stages of small redworm present, or if they're not tested, that they do have a treatment at this time for specifically for encysted small redworm at the late autumn and early winter stage. So which wormer, importantly, will we be using if we are going to treat them? So there's only 2 types of wormer that are licensed to treat encysted stages. That's a 5-day course of fenbendazole, or there's a single dose of moxidectin. And that can be either on its own or in combination with praziquantel, which is the tapeworm only wormer. I should mention at this stage, I do need to speak in active terms, so I can only talk about the actual product, the actual active ingredient that's in the product, rather than brand names. And that's because we are restricted with advertising laws to speak to the public about these products, and that's quite right, because they're prescription only medicines. It's not a case of promoting the brands, it's a case of educating and making sure that people have the information they need about the active ingredient. So just that's a word as to why it may seem that we're not talking about the brand names. So we only have these 2 choices of active ingredients, the active anthelmintic, if you like, in the product. And moxidectin is the treatment of choice for the prevention and control of this particular parasite. And that's because there's widespread resistance in the parasite population that we're trying to treat, those encysted stages, to that 5-day course in this particular parasite. I think one of the quite legitimate concerns is, okay, well, if moxidectin is working very well against this parasite, is it too harsh to be given in some situations? Do we need to worry about giving it if we think that the horse has a high worm burden? And that is a legitimate concern. I think we always need to be careful when horses have high worm burdens, and particularly if they're showing any signs of illness which might be related to those that have worms. But in this particular parasite, it's been shown that it's less likely to cause damage to the gut compared to if the other products that's licensed is working effectively. And the point that we need to be really careful of is, it's tempting to say, well, we'll use one of the other products, so an ivermectin, a pyrantel, or a single dose of fenbendazole. But actually, if we use these products at this time of year, and we've got lots of those encysted stages which are sat in the gut waiting to come back out at some point, these can actually encourage those stages to come back out of the gut, for the reason that they remove any adults which have sat inside the lumen. So think of it a little bit inside of, if you go to I don't know, a kind of outdoor area where everybody wants to have their own space, and you clear that space, then you're going to make room for other people to come into the area and take that space that was available. And that's what's happening if we're giving those single dose of wormers that aren't actually targeting those larvae that sat inside the gut wall. They clear the space in the gut for the larvae to come back out, and then they cause this damage as they come back out into the gut wall. So it is a concept which is sort of a little bit paradoxical. I think we just need to remember that it's important at this time of year to be able to choose a product and to be prescribed a product, because they're prescription only medicines which target those encysted stages within the gut wall to avoid any further damage if we use the wrong wormer. So moxidectin, again, just some information on that particular active. It is licensed from 4 months of age. You have to be careful with foals, because it's not licensed in those very young foals, so less than 4 months of age. And foals are particularly sensitive to that active ingredient, so you don't want to be giving a foal that product. The pregnant and lactating mares, it's perfectly safe to give those, and it can be combined with a praziquantel, a tapeworm treatment, to treat the winter threats so that you're then treating the encysted stages, the tapeworm, and also bots and other roundworms in a single dose with that Moxidectin praziquantel dose. The star here is just to say that in horses that are, so in foals that are less than 6.5 months of age, then they shouldn't be treated with that combination product as well. But again, this is something that your prescriber will do for you. They will find out the age of the horse, any particular reasons that they shouldn't be given a wormer, and they will prescribe that to you. Just to talk about the cost.
Wendy, sorry, could I just ask a question? Could I?
Yeah.
I'm sorry, it's Michael. Sorry to interrupt.
No problem.
So, as a person prescribing, so originally when I was taught this 10, 11 years ago, it was the view that Moxidectin was actually quite a harsh wormer. And if a customer was coming in saying that their horse was showing quite a high burden that you don't necessarily know about, or a new horse, that Moxidectin was actually too harsh to use and could, in rare cases, cause colic. Would you say that's true or not particularly?
I think you have to take each individual case on a case-by-case basis. I think it depends which parasite you're talking about. So when you're talking about the encysted stages at this time of year, if you give them another wormer which is not going to treat those encysted stages, then there's actually more risk to them, because you are risking the fact that those larvae may then start to come back out of the gut wall because you've created that space in there. So what you actually want to do is to give the product which is going to target those larval stages to prevent them from emerging. If we're talking about other parasites, so in particular, if they have high burdens of tapeworm, then death of large amounts of tapeworm can cause problems with colic. So that's if you give anything with tapeworm effective product in, so with the praziquantel side of it. And also if you're talking about, so if you're looking at other parasites, so younger horses will say large roundworms, the ascarids, then it's very important that those aren't killed off quickly, because they can cause blockage of the intestine, so an obstruction there. But in this particular case, at this particular time of year, as long as the horse isn't showing clinical signs of problems, so they're not showing weight loss, they're not showing diarrhea already, then no, I wouldn't be concerned with the Moxidectin with that product to target that particular wormer, that particular parasite, sorry.
Perfect, thank you.
Okay. Have we got any other questions actually on the encysted stages while we're there with the questions?
Nothing's come through yet, Wendy.
No. Okay, that's fine. Just stop me if we do need to go to those questions. So just on that vein, just talking about the cost of incorrect treatment for encysted small redworm. If we're talking about Moxidectin, we've got the cost of one wormer. And then if we look at the incorrect treatment, there may be cost of multiple wormers. If we give one wormer at this time of year, but then say, for example, the horse then starts to lose weight during December or January, it's suspected because of the time of year and the history that there may be a large encysted burden there. Then you've got cost of multiple wormers, and obviously then you need to use the correct one anyway. There's also the stress and concern. You know, this condition is very serious once they start to show signs, and you do want to make sure that it has been either tested for or treated effectively at this time of year. In adult horses in particular, then the test can be extremely useful, but in those cases where they have got worm burdens, so where they've already got positive worm egg counts, then we do need to be treating them as well for that. So we'll move on to just some of the other threats. Just again, I know with this talk from experience with it, it goes by very quickly. There's a lot of information to go through, and we wanted to make sure that you had got all the information in it. But tapeworm, they can be present in up to nearly 70% of horses in the UK, has been quoted in one paper. That does vary significantly between regions, and also significantly between pastures and different populations of horses. Tapeworm, I think that this is one of my favourite facts about tapeworm, that they can range from 4 centimetres to even 80 centimetres in length. And if you think about it, that's up to 4 20-centimetre rulers long, which is pretty enormous. I don't think anybody ever sees that being passed in one go, but what you do see is these segments. So this top picture on the right hand side, these are the segments of the tapeworm, and what you tend to see are these segments are passed out if you see them at all. So they're quite easy to miss in the droppings. The time that you might see them is after a worming treatment that is effective for tapeworm. So all horses are at risk of infection. Again, it's, you know, quite similar demographics to the encysted stages of the small redworms, but it's those that are less than 5 years of age which are more susceptible. And again, that's due to age immunity. They do develop some kind of tolerance to parasites as they get a bit older, and younger and horses are going to be more at risk than, say, your fitter, healthy adults. Then again, actually, as horses get a bit older, they do become a bit more susceptible to parasitic diseases again. So quite similar to how we would think about human diseases as well. This bit at the bottom that talks about impaction, spasmodic colic and intussusception. These are the types of colic that tapeworm can cause. And there's sort of quite well documented studies that show that tapeworm is associated with colic. And this is the reason why. So this is actually inside the intestine, this picture at the bottom. These are the tapeworm segments that are stuck to the intestinal wall. And it's at the junction where the intestine meets, so the small intestine meets the large intestine. You've got a natural narrowing at that point anyway. That's where the tapeworm tend to sit. And that's why they can cause impaction if you get large amounts of them, or they can cause irritation, which causes the spasmodic colic as the gut is trying to get rid of those tapeworm segments. Intussusception is a very severe condition, which is generally seen in young horses with high tapeworm burdens, where the gut has spasms so much that you get part of the gut goes inside another part and causes a type of strangulation there, and that's a surgical procedure to correct that. So the tapeworm is dependent on a type of mite which is found on pasture. It's the forage mite, and infection in horses therefore depends on whether you've got mites on the pasture that are the intermediate host of that, and also whether you have infected tapeworm there that will infect those mites as well. Just seen there's a spelling mistake with season. I think it was a typo on there. Sorry about that. And then you've got the mites are on the pasture, so they then take up the eggs which are on the pasture that have been passed by other horses with the infection of tapeworm. Those are eaten by the horse, and then the mite and the tapeworm develop together inside the intestine of the horse, which is then when they hatch out and cause problems by attaching into the intestine. And that whole process takes about 6 months for that to happen, and then to start pass eggs out in those segments again back onto the pasture. We do have some tests for tapeworm. There's a saliva test which can be taken, or a blood test. Both of those seem to give quite similar results. Again, in the same way as we have for the encysted stages, those do need to be interpreted with care. And one of the reasons for that is that the antibodies that they're testing will stay around in the body for quite a long time, so for a number of months after they've been treated with a wormer that might be effective. So it's not a simple case of saying, okay, we'll treat these horses, then we'll take a blood test and see whether or not those antibodies to that have decreased, because they will stay around in the horse for quite a long time, even if you have treated that infection correctly. So these need a specific wormer. So if we're not testing at this point, then we'd be looking to use a specific wormer for them. So there'd be Pyrantel, which is part of our double dosing that you would do at the sort of, generally it would be around September time. That would treat for tapeworm, or a praziquantel in a combination dose with either ivermectin or moxidectin for tapeworm, but remembering we're wanting to treat for encysted stages, so we're looking at a moxidectin for that, and then the praziquantel for the tapeworm as well. So before we move on to bots, any questions about the tapeworm?
There's nothing on the chat line yet, Wendy.
Okay, that's.
Oh, hang on, I have got one actually. It's
okay.
Should we treat for tapeworm once or twice a year?
Okay, yeah, that's a good question actually. So that does depend. The actual answer to that depends on the level of infection you have on the pasture. If you're testing, then you should start by testing every 6 months, and then you'll get an idea of whether or not there's a high tapeworm burden on the pasture. If you're not testing, then you should be treating twice a year for tapeworm. So once at the end of the season, so about now, and then once during sort of the spring, summer months as well. And that really aims to break that 6-month life cycle. But if you are testing, then you can start to bring that down, which will help to reduce the reliance on wormers with that. So with the bots, these are the final threat that we need to think about at this time of year in all animals. So we've talked about encysted small redworm, we've talked about tapeworm, and then finally just bots as well. These are the larval stages of the bot fly, which lives at the end of the summer. I'm not sure whether you've ever seen these. I saw my first bot fly, the actual fly stage of this for the first time this summer. And they're really like little bee-type, moth-type creatures. And they buzz and they cause, they try and chase you. So these were actually trying to get kind of by my horse's kind of mouth, sort of by my ear as well. I was like, I can actually see why horses really don't like these at all. And I really didn't know what it was to start with because I hadn't actually seen one in the flesh. So that was quite good to see. They do produce these eggs, which I think were much more common when sort of 20 years ago. We do still see these in areas. They're very characteristic. You see these yellow gritty eggs on the eggs and the sort of shoulders of the horses, which then they lick while they're grooming themselves, and then the bots will then enter the mouth. They tunnel into the gums, which is pretty gross, really, and then they will hatch out after a number of weeks, get swallowed and go down into the stomach. So this is actually a picture of the stomach, which has a lot of bots in, and they will overwinter there and cause problems if there are a large number of bots. So most horses that have any kind of worming treatment with either ivermectin or moxidectin through the year will be effectively treated for bots, but it's just to remember at this time of year that you are looking to give a treatment which is effective against that at the same time as you're giving something else. So just to be clear, I'm not advocating giving a number of treatments. What we're saying is that it's to use the type of actives that's going to get all of these threats together, and that would be a moxidectin praziquantel at this time of the year. So for the winter summary, it's important to remember that worm egg counts don't detect the encysted small redworm stages at this point. The egg counts that we've had throughout the year can give us an idea of the contamination on the pasture and therefore whether there's likely to be encysted stages present. But if you have negative fecal worm egg counts at this time of year, you can't rule that out. You need to either treat or test for encysted stages and tapeworm, and also bots as well. And beware that there is widespread resistance to fenbendazole to the point now where experts agree that you assume there is resistance to fenbendazole in this particular parasite unless it's actually been demonstrated otherwise. And that for this particular threat at this particular time of year, it's moxidectin praziquantel is the treatment of choice for that. So the next part of the presentation talks about how that builds into a worm control program to consider about sustainable worming and not reliance on just the worming products themselves. But before we do that, just to check again, there's no other questions relating to that first part of the presentation.
No questions, Wendy.
No. Okay,
Oh,
good.
hang on. There is one's just popped up. If the fecal egg count shows a 0 in October and has not been treated for 6 to 8 weeks, is there still a danger of the encysted breadworms?
Yes, so just to be clear on that, it hasn't been treated for 6 to 8 weeks before the 0 count in October. Is that
Yes,
how
that's
the
the
question
question.
is reading? Yeah. So again, yes, there is still a risk of encysted stages. What we're looking at is a period of time. So remember, a fecal egg count is only a snapshot in time. It's great that you've got a 0 egg count at that point, and certainly wouldn't advocate treating based on that for a normal threat. And October, it's still a bit early to be treating for encysted stages. But then as you get to November and December, remember there's still a risk that you do have some encysted stages there. It may be that it just hasn't picked it up on that particular worm egg count. And I would still advocate at the least doing a test for that to make sure that you don't have stages that you're not picking up with a worm egg count at that point.
Okay, thank you.
So we're looking at the pattern over a period of time is really important. So when we're talking about building a worm control program, we can't talk about worming without managing the pasture. So we'll talk about that in a minute, and that's really the most important stage for me in any worm control program. Also testing and what to expect from testing, so that kind of links to part of the talk that we've already talked about. What to do to plan your worm control program, and also dosing with the correct wormer as well. So the pasture management, it stands to reason that if you have less worms on the pasture, they eat less worms, and therefore they have less worms that can develop in their body. And the more that you stock the pastures and the less that we look after them, the more likely that is to happen. If you think about how close they are to the ground and the fact that they can take in those larvae, it's really important that we keep their pasture clean. The ways to do that aren't rocket science. So poo picking is something which is unavoidable for all of us. I'm sure we're very familiar with this. There's studies that show even if we do it twice a week over the summer period, that significantly reduces the amount of larvae which are on the pasture. So that's really good news. If you can do it every day, it obviously helps to keep the pasture much clearer. It's much better for the horse, and it also avoids us having to take barrow loads at the same time out as well. So I definitely advocate daily poo picking, but at the very least twice a week in the summer period. Biological vacuum cleaners, so that refers to cattle and sheep, just to say that if you do graze with different species, the idea here being that the parasites which infect horses normally can't go on and complete their life cycle in these species because they're specific to the horse, and therefore that breaks the life cycle and stops more eggs being shed out onto the pasture. You do need to be a bit careful. Liver fluke in particular was once thought not really to cause a problem in horses, but it is shown that it can cause a problem in some areas, particularly where you've got very wet areas. And if there is liver fluke demonstrated in the cattle and sheep on the area where horses are grazing, then that certainly should be discussed with your vet to make sure that they don't need a particular treatment for that. I think resting the pasture is really important. The problem is, how long do you rest it for them not to become infective? And most of us don't have that luxury of having lots and lots of different amounts of land where we can rotate as well, or combine harrowing with resting. So resting the pasture on its own isn't often a very good it's certainly not a good strategy on its own without clearing the droppings. And if you aren't able to do that, so if you aren't able to clear the droppings and you do need to rest the pasture, then it's recommended that you rest it until the following year grazing. So really they'd be grazing at the beginning part of the year, sort of March to June, and then you would rest it over the summer period, expose it to heat, which kills the eggs more effectively, and rest it until the following grazing season. So as I said, most of us don't have that luxury of doing that. Harrowing is the same. All you're doing with harrowing is trying to open up the larval stages and the eggs to more of the environmental temperatures, which is the heat which kills them. You do have to be very careful in this country, because if you have lots of periods of rain at that point, then actually all you're doing is spreading the infection over the pasture. So you want it before a forecasted period of 2 to 3 weeks of hot, dry weather, to try and kill off those stages. Not overstocking the pastures is really obvious, I think, for us. Reducing the pasture size is probably a little bit less counterintuitive. And the idea with this is that you have one horse per paddock, and that you're able to clear the droppings up from that, rather than running in a herd and getting infection and not being able to pick up those droppings. So testing the worm burden. Does my horse have a worm burden? Do I need to treat? And these are the important questions that we need to answer. And more importantly, actually, I think one of the things that we're really looking at is, are they passing eggs out onto the pasture? Because horses have worm burdens. That's something that happens. It's not necessarily something that's going to be a problem to that particular horse. But what is important is that we don't get the pastures more contaminated, so that we don't get burdens that we are unable to treat with the products that we have available. So the worm egg counts, fecal worm egg counts, these measure the eggs per gram in the feces. They're most useful for small redworm or ascarids. And the ascarids are the specific worms which affect foals, which we won't really touch on this presentation, but I'm sure that your prescribers will be very happy to discuss that with you if required. So really in this, we're talking about small redworm, which are the important ones for the fecal worm egg counts. And then antibody tests that we can do for either tapeworm or small redworm, either in saliva and blood for tapeworm, or just in blood for the small redworm. So when we're looking at fecal egg counts for small redworms, these faces, I couldn't find nice little cartoons of horses that I could slot nicely into the diagram, I think, when I did this. So they're faces instead, but each one of these represents a horse that's in the pasture. And the 2080 rule states that actually there's only 20% of the horses that are shedding 80% of the number of eggs. So in any pasture, you'll have some horses which are more likely to have higher burdens than others. And that's about 20% of those horses, which represents two of these horses, two of these faces on this diagram of our 10 horses. And what that means is that if you treat those two horses which are shedding most of these parasites, then you will effectively reduce the pasture management in the same way as if you treated all of them, but without adding that pressure for resistance that we are overusing wormers. And this is really the basis of why we do worm egg counts and why we are doing what we call selective targeted therapy. What we're trying to do is to reduce the amount of eggs that are shed onto the pasture without compromising the health of the horses that aren't being wormed. And this is something that necessarily means that we need to put some continued effort into it. If we just do one worm egg count, we don't know whether those shedding patterns are going to change, whether those counts are going to change throughout the year. And it's really important then that we do it 3 to 4 times through the grazing season. So that works at about 2 to 3 month intervals. And then we can see whether those horses are changing over time, whether they're likely to be at risk because they have a really high worm burden, but really importantly, whether they're contaminating the pasture, either if it's just for themselves, if they're just in a paddock on their own, or if they're contaminating the pasture for herd mates and for themselves as well. It's important to remember that while it gives an indication of how many worms that particular horse has got, it's not a directly linked relationship. So if you have one worm egg count that says 500 eggs per gram, and then in another horse it says 600 eggs per gram, that doesn't necessarily mean that that horse has more worms than the one that had 500 eggs per gram. It depends on the amount of eggs that was in that particular type of the part of the droppings, and it also depends on how many eggs those worms in the particular horses have produced. Clearly, if you get a sample that shows about 50 eggs per gram and one that's showing up at 2,000 or 3,000 eggs per gram, that would be a red flag to say, okay, the one with 2,000 or 3,000 eggs is much more likely to have a higher worm burden and be at more risk of disease than the one that's shedding low amounts. But what I really hope that you take home from that is that it's not a direct correlation. It only gives you a ballpark measure of whether those horses have a really high burden or not. What it does show is how many eggs they are shedding on the pasture, and that's what we really need to be talking about. It's a measure of egg shedding status. It's important to remember that each test is only a snapshot in time. We're only taking a very small amount of that dropping pile when we do it, and it's only occurring at that particular time as well. The eggs might not be uniformly distributed throughout that dropping, and as we've already said, those larval stages don't lay the eggs, so the tests don't give an accurate indication of whether you've got those encysted stages at this time of year. It's not suitable also for pinworm because they will lay their eggs differently. They're not distributed throughout the droppings. They lay those around the back end of the horse. And that tapeworm are distributed. They're shedding those segments, which is fairly sporadic, and they're harder to pick up on those tests as well as our bots.
So Wendy, we've started doing fecal egg counts now in all the farm centres, and obviously for sheep we do mob sampling, but obviously for horses it's critical we do individual sampling based on what you're saying about the 80-20 rule.
Yeah, absolutely, that's exactly right. So we would absolutely encourage to do individual sampling, because what we're trying to do is to identify those horses that are shedding large number of eggs and to use our wormers in a really targeted fashion so that we keep the effectiveness of that wormer for years to come. We don't want to reduce the effectiveness on the pasture, on that particular premises, by overusing the product.
Okay, Wendy, we've got one more question. Does the antibody test just show current infection, or does it show historic cured infection as well?
Yeah, so again, that's a good question. So it can show historic cured infection for a number of months. Antibodies, if you think about first principles, they are there to protect against infection. So if you give a vaccination, for example, you'd be inducing antibodies against a specific infection, and you'd expect those antibodies to stay around for a long period of time. And that's exactly what happens with antibodies that the body produces to tapeworm. So if you are testing with the antibody test, that will still show historic cured infection for about 3 to 4 months after that wormer is given, whether or not it's been effective. So if it's been effective, it will still show those antibodies.
And another question, Wendy, is there any known resistance to Moxidectin? And if so, what is the course of action?
Yeah, so again, it talks about, it depends which parasite you're talking about. With the encysted small red worm, there is very little resistance to Moxidectin. We do know, however, that in the small red worm, there are signs of resistance to Moxidectin, which is currently the most effective, and ivermectin for when we're not talking about the larval stages. And there are signs of developing resistance now, which is shown by the fact that we need to give that we're seeing the eggs reappearing more frequently in the dropping. So instead of reducing the egg count for 3 months, it might be reducing it only for about 6 weeks in some horses. If you do have resistance, it is very uncommon in Moxidectin in small redworm, the thing to do would be to really evaluate the pasture management and the worming plan in general. So to be working with your prescriber to identify all the risk factors that are there, to look at the pasture management, to try and have a planned way of approaching it throughout the rest of the year. So I'm sorry, it's not a single answer, but it's very much about planning and looking at all the factors and saying, okay, where do we not need to give this product and where can we use it in a targeted fashion?
Good, thank you.
Okay, that's fine. So remember, the worm egg counts, they're a tool for deciding if treatment is required. We use them to assess the effectiveness of a wormer. So unlike the antibody tests, we can have a look and say, okay, 2 weeks after we've done a fecal worm egg count, if we give a wormer that we expect to be effective against the stages that we're looking at, then we'd expect that worm egg count to have dropped very significantly, so up to 99% when we're talking about Moxidectin or ivermectin 2 weeks after treatment, and that's called a fecal egg count reduction test. So we can use that very effectively to have a look and see if the wormer is still effective. We can't use that for the larval stages, and that's because, you know, they're not reliable on the egg counts. So some of that we have to infer to those larval stages based on what we're seeing in the adult stages as well. But that gets really into the complicated detail of that, and that's something that your prescriber will work with you to look at and say, okay, do we need to do an egg count reduction test? How many worm egg counts are you doing throughout the year? How many types of products are you using throughout the year? Are you using them in a targeted fashion? What's your pasture management like? What's the other risk factors like in that herd as well? You know, are they young horses? Do they have illnesses? Do they have any history of disease? Those sort of things are the things that I'd be looking at. So the best advice that I can give definitely is to talk to people and to make sure that you take advice on it. I think there's also good information to show that once you get onto a good worm egg counting program, that overall that does reduce your cost of treatment, because for the vast majority of horses, they won't need worming every time, particularly when you get that management and the overall plan correct. So they do still need worming at some times of year, particularly at this time of year, but you can reduce those to the ones that you need rather than giving them all of the time. So this slide just talks about what we've talked about with the tapeworm antibody test, that it does remember the infection, that the antibody levels can remain high, and that care is needed when interpreting a positive result. And that's why you should take advice about the results that you receive with those. As I said, it's important to build a plan. It's what's right for your horse or for your individual yard or your field is absolutely not always going to apply to the horse next door. They may have individual needs, they may have different illnesses, they may have different histories and different burdens. So it's really important to plan for your own horse's needs, but if they are part of a herd, then to consider that herd's needs as well. When we're talking about the worm plan, what I wanted to show with this slide was that we have the encysted stages, the tapeworm and bots at this time of year in the winter. And then over the spring period, what we're going to do is to start worm egg counting. So February, March time is where you're really going to start to look to your worm egg counts, and then to space them out 2 to 3 months for most healthy adult horses. So over the age of about 3 years through the grazing period that we talk about, spring, summer and autumn. That's when the grass is growing, is sort of when we define the grazing period. To do those regularly, to make sure that you take into account whether they've changed fields, what the pasture management is like, and then to decide whether or not, based on those treatments, you need further worming administrations to them. Think about those issues that can affect your horse's worm burden. we've already mentioned that history can be important. New horses are actually a really good thing to mention. Even if they've had good worming history and good management, they've been stressed by the very nature that they've changed their environment, they've changed their routine, they've changed their feed in most cases. And therefore their immunity may wax and wane a little bit as well. So sometimes they do start shedding a few more eggs in those first couple of months, even if they have had a good history of a worming plan. So it is worth keeping an eye on those new horses and doing your worm egg counts to start with on those as well. Age youngsters are more likely to have higher burdens, and if they've got any immunocompromised conditions as well, those can be a problem. Remember, really encourage you this time of year, strategic doses. So dosing for those encysted stages is really important, along with the tapeworm and bots, or whether you're going to be doing testing for those as well. If a wormer is required, it's important to select the most appropriate one for the parasite you're trying to target and to give the correct dose. So always use a whey tape or a whey bridge. And remember that the whey tape is much more likely to underestimate the weight than overestimate it. So always round up rather than round down with your tape measure. I'd really like to kind of say wormers are prescription medicines. We wouldn't be thinking that we would go to a doctor, for example, and tell them which antibiotic we needed to use. So the point of this presentation is not to say that you need to remember which active you need to use on your own. It's to try and give you the information to say, okay, this is what you are likely to be prescribed. This is what you need to talk to your prescriber about and ask them about. You're not expected to do it all on your own. The information changes on a regular basis. There's so much information coming back out. It's an ever-moving playing field with worming horses, and that's why they're prescription-only medicines. Reviewing the plan regularly, and I'd suggest minimum of yearly with your prescriber, is really important, and get that relationship going so that you can respond to individual needs and changes. Do have a look. We've got more information if you need it. There's we've got a site, horsedialogue.co.uk. We've got lots of information about horse health, ownership and activities, and blogs to share with that as well. And yeah, any further questions?
I've got one question, Wendy. What is the safety margin of Moxidectin in horses?
Yeah, so Moxidectin, all of the wormers have good safety margins. Moxidectin would be at about 2 or 3 times overdose. You would expect to see some adverse reactions there. That is on the data sheet. So it is generally fairly safe, but what you mustn't do is to overdose it by weight. So particularly for very small horses, because they are proportionately going to be much more at risk. So if you have a 100-kilo horse and you give it a whole tube of a Moxidectin, which is 700 kilos, then you can see it's going to be much more at risk than if you slightly overdose a 600-kilo warm blood.
And the safety margin of praziquantel?
So praziquantel probably is going to be much more safe on a dose basis, but you do have if you kill off a large amount of tapeworm at once, then they can react to the protein that you kill off. So actually the fact that it's being effective is going to be your issue that you're thinking about. So I'd really encourage you that you do have that safety margin if you dose correctly. If you're weighing them and you're thinking about the dose that you're giving, that shouldn't be an issue that's a primary concern. It's if you give a whole tube to a horse which is only weighing a couple of 100 kilos, that's when I'd be concerned.
Okay, thank you. One more, Wendy, if a horse hasn't been wormed for some time, how safe would it be giving the combination of Moxidectin and praziquantel if there was a high worm burden present?
Yeah, again, I think that's also a good point. I think if it hasn't been wormed for a long time, you don't know the burden. and you don't know, and particularly if you don't know the history of the horse, then separating those two products out can be very useful. So you can give the Moxidectin on its own, and then you could give, because we don't have a single dose of praziquantel, which is licensed now, you could give a double dose of pyrantel for the tapeworm at a separate time to that. But I think really importantly as well, I'd really like to stress, if the horse is showing any signs of illness or potential from a worm burden, then it's important to do this under the advice of your vet as well, so that you don't precipitate signs of problems. But in your horse that is not showing signs of illness, the horse that is generally well otherwise, then as long as you dose correctly and as long as you're following the recommendations, that should be something which should be safe to do. Okay,
thanks. Wendy, very interested to hear you mention liver fluke. I mean, we get so much liver fluke in sheep and cattle in these parts. Any sort of liver damage was assumed to be ragwort with horses. I mean, how widespread do you think liver fluke damage in horses is?
Yeah, I think the prevalence is more than we've thought before. I know there are studies that are ongoing to have a look at that. You're right, ragwort should always be ruled out when we have liver damage in horse. That is it's really important. But liver fluke should be considered if they are grazing with cattle and sheep, and particularly if they have shown signs in cattle and sheep. The other thing is that liver fluke and ragwort do show a slightly different picture on the blood work that they show up as well. So you're going to have signs of different enzymes which are going to be affected with liver fluke rather than with ragwort, which tends to be fairly specific.
Okay. I mean, one comment has been posted about using a combination, one of your combination cattle products, which is completely unlicensed for horses. Would actually work rather well, I'm sure, but not for tonight.
Yeah, so with liver fluke, I think it is important to mention there isn't any licensed products for horses with liver fluke, and therefore it is required that you do get that on prescription from your vet, who can prescribe a product that is suitable on the cascade. So that they have a prescribing cascade which they're able to prescribe products which on a risk-benefit analysis they consider to be beneficial, if there isn't a suitable licensed product, which currently there isn't for liver fluke in horses.
Yes, I just wonder how many sort of horses are slightly anemic, having a burden of liver fluke and just living with it. It'd be quite interesting to find out.
Yeah, potentially, definitely. I think, there's still a lot we don't know about liver fluke in horses. Certainly, a number of years ago, we always used to consider that, that it couldn't cause disease in horses, but actually we do know that isn't the case now, that some horses are symptomatic with it.
Even humans, I was taught growing up not to eat the watercress from the local brook.
Good advice.
Right, well, Wendy, there are no more questions. Thank you very much. It's a lot of information. I mean, I had no idea that the tapeworm could grow to 80 centimeters, or that a bot could lay 1,000 eggs in its lifetime. Fascinating stuff. And we think that nature's so benign sometimes, don't we? Some really interesting stuff there. Thank you very much. Any more questions from anyone before we wrap it up? I think that's it. Wendy, thank you very much for taking the time tonight. Really enjoyable, really informative. Thank you.
Oh, thank you very much for the opportunity. Thank you.
Okay. Good night.
Thanks.
Bye.
Bye.